Thank you. On awards and appearances, we have Dr. Joe Pepe is joining us via phone as well. Dr. Pepe?
Yes, good evening, Commissioners. Can you hear me okay?
Yes, sir.
Yes, sir. Okay, great. Thank you. I will keep my comments brief. Just thank you all for the opportunity to present to you, and I certainly appreciate your leadership in demonstrating social distancing while maintaining an open meeting to our community. I'm very impressed by your creativity and willingness to serve our community. With that, I'd like to dive in to just a quick update as far as the COVID outbreak, where we're at today, some of the actions that have been taken, and where we're headed in the near future based on some models that I've seen. So currently, globally, we're looking at just under 2 million total cases in the world. The United States is sitting around 589,000 cases. We are seeing a global curve change as far as the number of new cases from the peak of being somewhere in the area of 101,000 new cases daily back in the beginning of April the 4th, to where most recently we are at 79,000 new cases. So we are starting to see a downward trend globally, and hopefully that's a good sign. That doesn't mean that all countries are declining. That just means some of the major outbreak areas are declining. However, we are seeing some spread in newer countries and areas that COVID was not before. When we look at the state of Florida, we're at 21,367 cases as of this evening. We have a total of 2,900 hospitalizations, and unfortunately 524 deaths in the state from COVID. We are seeing the same trend that we see globally as far as for the state, with a peak back on April 3rd of 1,300 cases as a daily high to most recently 1,000 cases. So we have been hovering around 1,000 cases a day for the last 4 or 5 days. So the goal is hoping that this continues to be a statewide trend. However, same as I mentioned before, not all counties are the same, where we might see Miami-Dade, Broward, and Palm Beach County, which have 58% of the total cases for the state of Florida, leveling off or potentially a downward turn. We're seeing some increases in other areas of the state. As we know, our cases have been increasing. The daily number of cases per day have been hovering around 2 to 3 new cases a day for the last several days since the 8th. And a lot of that associated with clusters in businesses, facilities, and household contacts. We do not see, based on our data, a widespread community transmission at this time, although it is expected that case numbers will continue to rise, especially since we're adjacent to Palm Beach County, which has a significant amount of cases. And we are working very hard to stem that tide. Big challenge for us is our travel patterns to the southeast of Florida. Many of our citizens work in those counties or have relatives, and so back and forth travel has become a challenge for folks possibly being exposed to COVID in those counties and then bringing it back. When we look at the characteristics of coronavirus and the age category, it is impacting people across all ages. However, the most significant population group that has been impacted, mainly just because the number of people in that age category, is the 65 to 74-year-olds. And the number of hospitalizations for people above 85 years old is 123. To give you an example, put this into perspective, there have been 714 cases for people above the age of 85 and only 123. Now, unfortunately, 123 is too many. However, just to put it into perspective and showing that our hospitals are doing an amazing job in taking care of even our most vulnerable patients. The primary complaint that we're seeing for individuals presenting to the emergency room has been shortness of breath. Cough and fever have now reduced down to levels below that of what was the peak of flu season, somewhere around the end of January, early February. And so we're continuing to see that trend statewide across multiple counties. For Hendry County, we're looking at 23 cases right now, and we do expect there to be more cases. However, I am pleased to report that we are clearing cases. Right now we have 8 cases that we have cleared. So even though we have 23 cases, there's not 23 active cases right now. all but one of those cases are in Clewiston, with one case that was cleared in unincorporated Hendry County. So it's great news to see people recovering and doing well through this. We do have plenty of testing capabilities between the hospital, the community health centers, the health department, as well as we've received some additional supplies, and we are training tomorrow to finish standing up our collection program as a partner with Quest Labs. So we'll be able to continue to support testing, and we're going to focus primarily in Clewiston first, and then work our way backwards into LaBelle and Moorhaven based on need from the community. When we compare Hendry County to the rest of the state, our incident rate right now for Hendry County is 60 per 100,000, when compared to Florida, which is at 97 per 100,000, and New York City, or New York actually, is 1,158 per 100,000. We've tested 318 people, 23 in Hendry, 5 in Glades, and 257 of those tests came back negative, with 31 tests pending, and we've had a positivity rate of 8%, which is suggestive of that we're targeting those high-risk individuals and identifying the positive cases in our community. When we look at the outbreak model, there's several different models that I've been looking at, and the one that has been kind of the most steady and consistent has been the model out of Washington State University, and I compare that with the model being used by the National Guard as well as other models, and they're all fairly consistent with the predicted peak for the state of Florida as well as the United States is somewhere between now and the beginning of May. And when we look down into Hendry County, because our numbers are lower compared to the number of people per capita, the model isn't as accurate, and just because of some errors in statistics. Realistically, we would expect, and I would see where it looks like peak utilization for our community is somewhere between now and the end of the month. So it is too early to let our guard down. And just want to share with you also that we're still seeing influenza throughout the state, as well as in our community. We have had a significant amount of H1N1 cases in the state of Florida this year, somewhere over 1,100 to 1,200 cases of H1N1. As you remember, in 2009, H1N1 was the novel influenza that was very, very concerning to our community, and we still see that on a daily basis today. So we are also, just to put things into perspective, working through a hepatitis outbreak statewide. However, I'm pleased to report that the social distancing and controls that we put into place for COVID have also had a very positive impact on number of cases for hepatitis A and pretty much other activities as well. So we're very pleased to show how effective social distancing and those control measures have been put into place and are effective. So I thank you all for your support and your help in that guidance. And I know it's not easy for anyone right now, but it's been proving to be effective as far as flattening the curve so that our medical surge is not overrunning our hospital infrastructure. Hendry Regional is doing well. They've done a great job in expanding resources, and we've been supporting all of our medical providers, including Hendry Regional, with additional protective equipment and supplies to kind of keep them protected and be able to serve our community. We've restructured somewhat at the health department to essentially 3 general categories: monitoring, screening, and investigation, and then we have a rapid response team. The monitoring team pretty much is going out doing exactly what you think we would be doing, interviewing people, talking to the community, and identifying who needs to be tested and screened, and working with our medical providers. Then we have our screening unit, which are the people that are supporting all of the testing operations. And then we have our investigative unit, which is our epidemiology team, our nurses, our nursing director, and they work with all of the community partners as well as medical providers to go out into the community and interview those who may have been exposed to COVID and or positive with COVID to try and contain it and mitigate risks to the community. As part of this operation, we've also established a webpage, Stronger Than C19, which is a community action survey, and that survey allows us to gather data from everyone who fills out that survey in order to start to identify those who may be symptomatic, those individuals that are at risk, and the overall vulnerability of those communities. And we're putting all that back into a database in which we're using to model in order to prepare for not only medical surge, but also patient movement in the event that we need to support those activities. Speaking of patient movement, we've pre-staged in 3 counties to our east and then 1 county to our west in Lee County, several mobile hospital units. On the East Coast, they're about 1,000 patient each facility, and Lee County is 250 beds to support not only COVID patients, but hospital step down in order to free up the hospitals to support more COVID patients. To date, we've distributed, and I won't go through all of these things, but just some of the highlights, over 10,000 gloves, over 1,200 gowns. We've had several bottles of hand sanitizer in varying forms. I'm pleased to report that our community, including U.S. Sugar, has stepped up to help us produce hand sanitizer, and it's very much needed, especially for our responders. So thank you very much for those who made that happen. Almost 2,000 masks and 5,600 procedure masks and another 1,400 face shields. We've also distributed another 100 thermometers. So one of the pieces that we've seen that is a pattern that we're working through is make sure that our mental health component is supported in our community, and all of our mental health providers have gone to telemedicine, teletherapy, and they also have their crisis intervention teams, and they're all in effect and working right now, and they have not reported that they've been overrun and have been able to support the needs of the community. As one of the areas that we've been focusing on as well is non-congregate housing. We've been working with emergency management and county administrator and our community partners to develop a program in order to support non-congregate housing, meaning that if we have an individual who is COVID positive that we need to isolate, but they do not have a place to stay, we are working through that process now in order to establish protocols and resources for them to have a place in order to support them through their recovery and make sure that they are not spreading COVID to the community. Just as a reminder, I wanted to share with you all just some general thoughts about COVID. The social distancing component is within 6 feet of each other. I've seen many of our retailers really help out with counting the number of people going into stores, and then also even readjusting their aisles so that they're single direction in order to help support spacing. The typical symptoms continue to be fever, cough, and shortness of breath. Although we are seeing about 85% of the people that have COVID have extremely mild to moderate symptoms. However, there is a percentage of population that this hits them pretty hard, and they end up needing some fairly significant hospital intervention. We're still trying to gain a better understanding as to who these at-risk individuals are. The individuals that we've seen so far are people that have significant underlying health conditions, such as cardio and pulmonary issues. And so that's why the recommendation by the governor was to be safer at home. There's a few web pages that we have published, not only with the Department of Health. You can go to the Hendry Health Department webpage with links, as well as to the CDC webpage. And then there's some general guidance as far as use of hand washing, hand sanitizer, staying home when you're sick, and avoiding others who are sick. And I just want to circle back and say thank you all again. I know this has been tough times, and we will learn a lot from this and get better as we move forward, just like we have with every other event that we've dealt with in our community. But I know that we'll get through this, and my prediction is that things will begin to improve within the next 4 to 6 weeks dramatically in order to where we can start to begin some recovery efforts, not only for our community, but also our businesses, to help them get back on their feet and finish up strongly this year financially. And with that, I'll answer any questions you might have.
Dr. Pepe, Commissioner Harris. So we have 15,
Yes, sir.
15 cases right now.
Yes, sir.
Okay, and 1 child, right?
Yes, sir.
Okay, thank you.
Yes, sir.
Hey, Dr. Pepe, Mike Swindle.
Yes, sir.
Hey, so just right at the very end there, I just maybe ask you to elaborate a little more. You said that you think and I know that there's no exact science unless you can help me understand that as well. 4 to 6 weeks before you think we're back to some normalcy, you know, with regards to interactions, schools, and things like that. You don't think? Can I give you an idea of what you think is going to be safe on that?
Yes, sir. That's really the question of the day that we're all asking ourselves. We're looking at this on a daily basis. If the number of new cases continues to decline, and nationally as well as internationally, and our county continues to follow that trend. Right now, we've sort of been leveling off. We've had a few significant spikes, so we're not there yet in our community. However, if we start to see that happen, that's an early indication that we can begin to look at opportunities to start opening back up a little bit more, working with our school districts and our restaurants and folks. And that's really where I'm going to need your guidance as you're embedded in the community and talking to individuals is how can we best do this safely and not step down our guard too quickly in order to have an outbreak or a rebound effect, if you will. All of the models are stating by early June we should be well into the decline of this outbreak, and so long as the community and control measures continue to hold. If our community does not follow the guidance, then this will last much longer.
Dr.
Wow,
Pepe,
okay.
Commissioner Byrd, are we considered to still be in the peak?
Yes, ma'am. The models are all a little bit different, but anywhere between now all the way through to, let's say, the first few days in May are statistically where the peak are right now. The models have been shifting slightly, and I think that's part of, as they get more current data, they're kind of pushing that information in, and based on the influences of our adjacent counties. So I'll continue to keep you all apprised on that on a daily basis if I see anything significant to that shift. But it has been wobbling back and forth somewhere between middle of this month to probably somewhere around the end of the first week of next month.
Thank you, and thank you for all that you do. We really appreciate it.
Yes, ma'am, likewise.
Any other comments, commissioners?
Yes, sir. Dr. Pepe, you're saying that we've tested 318 people at this time, correct?
Yes, sir.
That's between Hendry and Glades County?
Yes, sir. Predominantly in Hendry, just because of size of population. Now, that number also can be potentially underreported. We have had situations where people have been tested out of state in other labs, and so that information is not making it back to our dashboard. We did send out some guidance through.
We're not talking about 100 people. We're talking about 10 to 15 people, probably, correct?
Yes, sir. But yeah, I don't think it's a big number.
All right. Doc, are you understanding that Palm Beach County is going to start testing asymptomatic people? Have you heard that?
That has been the guidance in some areas. We will be doing the same as well. As we are waiting on about 500 test kits to get approved by the labs to accept them, and there are some scenarios in which we're going to be testing some asymptomatic individuals, especially in high-risk areas like nursing homes and healthcare facilities and areas where there's close interaction with others. I'm also working through ordering some of the kits that can tell us whether or not you have antibodies to COVID, to show whether or not your body has developed any type of, or has experienced any exposure to COVID, which helps also with our investigation work.
Doc, what kind of dollars and cents are you talking about with wanting to order these kits?
So the test kits for the antibodies is a unit price of $10 each. And so I was looking to order a minimum of 1,000 at first, and then go from there, or 100 rather, so $1,000 at first, just to work through, because I want to gain a better understanding, especially for our first responders and medical workers, what type of potential exposure has been occurring, as well as also gaining a better understanding in our nursing homes.
Doc, do you feel right now, and I don't mean to put you on the spot and hold you to this and say, oh, you know, we need to beat you over the head with a stick on this one, but let's just say, for discussion's sake, off the hip, I don't need an exact number, how many kits, testing kits, do you have for COVID right now between Hendry and Glades County, how many kits do you have? Overall system, not private providers. The Health Department, Florida Community Health Center, Hendry Regional Medical Center, how many do we have?
So, right now I have 500 kits that are, waiting to be approved. I have another, 139,
In your,
158,
158 in possession right now?
yes, sir, plus another 500 that we're waiting to approve, so that would be 658.
No, sir, you have 158 right now, right?
Yes, sir, plus another 500 that we're waiting for approval.
How many days have we been waiting on approval for that, Doc?
So we received 4 out of 5 approvals as of today, we are waiting on the 5th one as of today, if not hopefully tomorrow.
And so then that 500 would hit the ground when?
Tomorrow. As well as, yes, sir, as well as, Quest has, pushed forward another 50 as well.
Okay. The point that I'm driving at with this, Doc, is I would like to ask our board and our county administrator to make resources available, and that's in a financial need. You know, she doesn't have to come back, the county administrator doesn't have to come back to the Board of County Commissioners whenever we're in a state of emergency like this. I don't want us to be standing on principle of we're trying to shop a number. I do understand that Hendry County's not flush with cash, but at the same time, you know, if we need to stroke a check to engage a private lab that is sitting there with 100 or 1,000 test kits available for us to be able to make a resource available so that we can get a little bit more, no, let me rephrase this, a lot more aggressive with regards to testing, I'd like to make those resources available. I think that 318 people tested. We're moving into, we started testing on March 17th, I believe it was. Can you confirm that, Don?
I don't have the exact date, but I know that's when it really started to ramp up in testing, yes.
Yes. So, you know, I don't know what that does statistically, but when I looked at the statistics the other day as it related to us being, Hendry County being tested, and I didn't even put Glades County into the mix, I felt that we were a little bit under the state's average. You know, you referenced 60 per 100,000. I just think that we, as a community, have the ability to control our destiny a little bit better than relying on Tallahassee or relying on the federal government to give us resources. And I think that if we could align those resources, put them on the ground, by resources I'm referencing completely, into PPE and test, so that we could get aggressive with looking at what is the spread like in our area, and then how are we going to combat that, and then how aggressive do we need to be with saying you have to wear a mask or you don't have to wear a mask, or a mask is just strongly suggested. You know, we can open up different things. We can look at having different industries. We can have a little bit more of a timeline associated with, depending on obviously what the executive orders that come down from the governor are or are released. We can look at opening up and existing again. But you know, 318 people out of 40 plus 15,000, 55,000 people. That's not a lot, and yet we know that we've had a handful of tests that have come back positive in the last few days, and I think that raises everybody's blood pressure. So those are just some thoughts that I have. The final thought, until you comment some more, and if my colleagues have anything to say, is that I am anxiously awaiting to clear up the 33440 zip code debacle. I don't think that you have any say over that. I don't know how that all plays out, and I assume that everybody knows what I'm referencing whenever I say the 33440 debacle, and how the fact that that code extends all the way around to Pahokee, basically, and then comes all the way back over to basically the center of the county, and then shoots all the way down to the Seminole Tribe Reservation. And, you know, Doc, you referenced Palm Beach County being our neighbor. The last report that I saw as it relates to the workforce in Hendry County, I believe we have roughly, 6,000 people a day that come into Hendry County to go to work. And that goes as far north as Martin County, all the way down to Miami-Dade, with the largest percentage being in Broward County that come into the county every day to go to be gainfully employed here. So I think that we have a lot of things that are coming at us that we don't really have control over. And I just want you to hear loud and clear, and I want my colleagues to hear loud and clear, that if it's just if it's between $5,000 to $25,000 for us to put 1,000 test kits on the ground that are rapid read, some PPE, and get some things in here so that we can look at the Hendry County population specific and the Glades County population specific and know exactly how healthy or unhealthy we are, how many asymptomatic people are carrying it and potentially spreading it. I'm ready to do that, but that's where I'm standing right now, and I will rely on you as the Department of Health representative for the state of Florida for us to give us your best recommendation, along with the other health professionals out there. But my personal opinion is we need to press the gas harder. Thank you very much, Doc.
Yes, sir, and I hear you loud and clear. We've reacted to your comments, and, you know, that's part of the reason why the Quest Lab support. We're looking at least supporting easily 50 tests a week there, and then with the additional testing that we're doing through Hendry Regional, the convenience care, as well as what we're doing, we're looking to drive that number up significantly. And another piece of where I want to really drive up the asymptomatic testing is in those areas that we talked about, because that is a major concern. We have seen people with very mild symptoms that were COVID positive, and that's concerning because I don't want those individuals traveling within the community not even realizing that they have COVID. So I hear you loud and clear. We are definitely ramping and rapidly working towards that.
Other comments, commissioners? Dr. Pepe, again, thank you for all that you're doing. We know that you've been very, very diligent in this, the Hendry County health system throughout Lewiston and LaBelle as well. We know you guys are working very hard, many hours. The question I would have is the test kits we do have, say we drop 1,000 more tomorrow, does that mean you can test 1,000 more people tomorrow, or are we testing what needs to be tested now? I mean, where are we really at?
So we have, yes, sir. We haven't turned anybody away from testing, or we've had enough tests. What we haven't had the ability to do until recently was to open up more testing, just because the limiting factor was the actual collection kits. Now that we have those, we're ramping up even more, and then with the support of Quest, we'll be continuing to open that up. So between Hendry Regional with their drive up, as well as what we're supporting at the health department, we should see a fairly significant increase in testing over the next week or two. And my understanding is that there are another significant push of test kits coming down from the state as all part of this approval process. They already told us that once these are approved, there's going to be another significant push out to all of the counties. So my guess is we'll probably receive another 500 to 1,000 test kits again.
Okay, just to follow, like Commissioner Turner was saying, we want to make sure that we're doing what we can do, everything we can. So that's the reason the question was a follow-up part of Commissioner Turner's statement there. So again, we appreciate all you're doing, and just keep us, you know, we're relying on you. You are the expert, you are the professional. So we're relying on you to keep us where we need to be. Is there any other from the commissioners? I think Commissioner Swindle just flew off.
I promise that's not me.
Mr. Lapp, do we need to take public comment on this, or
No,
this is just a presentation, correct?
Right, it's up to your discretion, but you do not have to, because it's not a vote.
Okay. Okay. Well, Dr. Pepe, again, thank you so much. We appreciate you. And if there is anything Hendry County can do to get behind you and push you, let us know. I believe you're hearing the push here is let's do what we got to do to make sure the people of Hendry County are safe. So again, thank you, and just keep us abreast.
Yes, sir. Thank you.